So good evening. It's a great privilege to be here. I don't know if you know, but in Canada, 25% of our population lives rurally. About 10 to 15% of the physicians live and serve rurally. And about half of those, 50%, are international medical graduates. Whether we realize it or not, in British Columbia, health is global. And our ability to serve our citizens is predicated on our connectedness. The World Health definition of global health is an area of study, research, and practice that places priority on improving the health and achieving equity in health for all people worldwide. What does that mean? It is as much about Aboriginal health as it is about rural health, the health of our urban disadvantaged populations, as it is about health in Zimbabwe, the second poorest country in the world. In short, I see it as equity and porosity between silos. People work hard and well, but often within silos. When we speak of equity, let us consider equity as Canadians, but also as human beings. I've been asked to share my vision of healthcare and the future of healthcare. Just think about the possibility of living and operating in health equity as human beings to the benefit of all. Healthcare in BC will thrive because it is actively connected as a part of a global health ecosystem. We will only find health and wellness in ourselves when working with others to achieve it for themselves. I find this to be true as a provider, and I believe it to be true of us as a healthcare system. I'm going to speak to this through the lens of the work that I'm involved with between Zimbabwe and Canada. I guess the first question is, what are we doing? I leave tomorrow morning, actually. We support and take teams from Canada and even Australia out to Zimbabwe to work with our Zimbabwean partners at community level, rural district hospital level, and at the university level. So what does that mean? Well, just over a year ago, we took a team from Valmont, including paramedics, nurses, medical office assistants, admin people, lab, medical students, GPs, and specialists. We worked with community health workers at Snake Park, as well as Kuranda Mission Hospital, and at the university. The work is focused on capacity building rather than service delivery, and is guided by our partners. The team we have leaving tomorrow will focus on helping support a community health worker education platform, enhancing ultrasound and surgical options in our partner sites, and helping with faculty development for a rural family medicine program. So how does our connectedness and reaching out beyond our own silo improve what is happening within our silo? I can give you 3 illustrations from my learnings and the work that we're doing in Zimbabwe. My hopes for healthcare. My first hope is bidirectionality and porosity between silos. When we started this work, we looked at the literature, and the literature shows very clearly the main beneficiary of people moving from a high-resource setting like Canada to low-resource settings like Zimbabwe or some of our First Nations communities. The benefit is to those in the high-resource settings. They come back being more likely to work in socially disadvantaged areas in their own country or community. They tend to make wiser choices in prescribing, and they tend to be more rational in the ordering of investigations. The literature shows that the harms of this work are more common in the low-resource settings when the focus is on service delivery exclusively, when we fly in with our capes flapping. When we work in Zimbabwe, we acknowledge and appreciate the value of this opportunity to us and focus on learning, building relationships and capacity with our partners in Zimbabwe, not on service delivery. We bring what we have to the table with humility and look for the synergy with our partners in Zimbabwe. In having easy movement between silos, be they clinics, communities, health authorities, provinces, and countries, we will better support the care in our silos and in others. My next hope is generalism. Generalism is a philosophy of care distinguished by a commitment to the breadth of practice with each discipline and collaboration with a larger healthcare team in order to respond to patient and community needs. The day we lose our foundation of caring and service, we become technicians and cease to be professionals. How does working in Zimbabwe support this? In a low-resource setting, it's really hard to hide from the needs of the community or patient, and it starts to shape conversations like, as a physician, how our practice should be shaped not only by my interests, but also by my community need. This is best seen in our approach to risk. It's a generalist who realizes that there is risk in not doing something. It's just that risk is offloaded to the patient. My final hope is health as a health ecosystem. We have many lessons from conservation. When the conservation movement started, it was around areas of passion and geography. potentially even competing with each other. So you had the river people, the mountain people, the ocean people. Quickly it became apparent that you couldn't work on one without influencing the other, and so developed groups like the Nature Conservancy, and ultimately our understanding of climate change. We see this in Zimbabwe when short-term medical volunteer work is focused on service delivery. It causes more harm than good. In a resource-constrained system, it diverts those precious resources away, and so when the well-meaning service leaves, you leave a void. It's very obvious that we learn this from our First Nations community in their approach to health, where it comes from a wellness perspective and demonstrates how health is linked to the environment, looking to wellness not only for now, but for the next 7 generations. Our approach has to transcend our silos of geography, silos of medical disease category, silos of profession, and even time. One cannot have optimal health in our community or even practice if there is a huge gap in another community. It's because of my hopes for bidirectionality, porosity, generalism, and healthcare being an ecosystem. I believe that we can only find health and wellness in ourselves when working with others to achieve it for themselves. So what? I'm not asking you all to go to Zimbabwe. Well, maybe I am, but no, I'm not. That's my story, guided by my heritage. What is your heritage? What does your story involve? I'm asking you to recognize and acknowledge your own silo. I guarantee you we're all in one. We cannot eliminate them, but we can make them more porous. Look outside your silo, consider where there might be an opportunity to serve in another silo, and find synergy there. By doing this, we'll make our silos more porous. And in doing so, you'll be a better provider, and your patients will be better served. Thank you.